Welcome once again, friends, to the most commonly repeated one-liners in ENT. Myself, Dr. Narendra Singh Chauhan. Today we will continuing with the part 7th of the series. So, beginning today with the question number 1, which says, "Institution tube opening into the middle ear cavity is." So, institution tube opening in the middle ear cavity is at the anterior wall. This institution tube is also known as pharyngotympanic tube, which connects the nasopharynx with the middle ear cavity, and it opens into the anterior wall of the middle ear cavity. Second question is tensor villa palatini. Tensor villa palatini muscle. Tensor villa palatini muscle is responsible for opening of the institution tube. It's responsible for opening of the institution tube. Third question is, this is the very important question, which says that floor of middle ear cavity is in relation with. So we have to keep in mind, it is a very important question, that floor of middle ear cavity is in relation with bulb of internal jugular vein. This is internal jugular vein. Internal jugular vein. Question number 4 says, function of stria vascularis. What is stria vascularis functions? Stria vascularis is responsible for maintaining the electric milieu of the endolymph. It is responsible for maintaining the electric milieu of the endolymph. We have to keep in mind. Question number 5. We know that for the movement of body, two main components are responsible inside the ear. One is the macula and second is the cristae. So, the static part of equilibrium is controlled by macula. Macula are present inside the utricle and saccule and are responsible for linear acceleration. This question either can be asked as linear acceleration, so then also the answer will be macula. If it is asked as gravitational movement or head tilt movement, then the answer will be macula. The second part, the second component is cristae. Cristae, as we can see, these are present inside semicircular canal. C for C, cristae are inside the semicircular canal, and these are responsible for rotational and angular movement. Which one? Rotational and angular movement. Coming on to the sixth question, that is the singular nerve. Singular nerve. Singular nerve, this is commonly repeated question. It says that inferior vestibular nerve. Singular, we have to keep in mind IN. IN is for inferior vestibular nerve, which supply posterior semicircular canal. It supplies the posterior semicircular canal. So, the branch of inferior vestibular nerve or inferior vestibular nerve supplying posterior semicircular canal is known as singular nerve. We have to keep in mind. Lateral wall of attic is known as scutum. So what is scutum? Scutum is the bone above pars flaccida. Scutum is a bone above pars flaccida. So, and forms the lateral wall of attic. Forms the lateral wall of attic. The angle of TM with the horizontal is 55 degree. The TM is not at the angle of in direct line with the horizontal, it forms an angle of 55 degree with the horizontal. So angle of TM with horizontal is 55 degree. Endolymph resembles intracellular fluid. Okay, the composition of endolymph is more similar to intracellular fluid as compared to extracellular fluid. Now coming on to the 10th question, that is the facial nerve lies with which nerve in internal auditory meatus. If the question is asked as the facial nerve lies with which nerve in internal auditory meatus, then the answer is vestibulocochlear nerve. Facial nerves lies with vestibulocochlear nerve at internal auditory meatus. So this finishes with our part 7 of the most commonly repeated questions in NEET PG in ENT portion. If you like the video, kindly share and subscribe and stay tuned because a series many parts are coming.